If you're over 45 and have ever thought about trying anal sex with your partner, stop for a moment and listen carefully, because there are things almost no one talks about openly. Yet they can completely change your intimate life or seriously affect your health. After 45, the body goes through unexpected changes. Sensitivity isn't the same anymore, and practices that once seemed safe when done without proper guidance can now lead to serious issues. And I'm not just talking about temporary pain or bleeding. We're talking about serious complications. There are people who start passing stool through the vagina after just one poorly guided experience. Urinary tract infections that don't respond to antibiotics. Persistent discharge that even gynecologists struggle to treat. And even cases of fecal incontinence. An embarrassing condition that deeply affects a person's daily life. And there's more. The risk of HIV infection through anal sex is real, yet very few people know the details. But don't worry, this video isn't against anal sex. On the contrary, it's a medical and fact-based warning so you can live your sexuality freely, but with responsibility. I'll reveal things you've probably never heard before. For example, there's one position almost everyone uses, but it's actually the most dangerous of all. Some lubricants can increase the chance of needing surgery, and there are small anatomical details that, if ignored, can cause permanent damage. The worst part, no one tells you this. But I'll explain it clearly, without taboos or judgment, and there's still more at the end of the video. I'll show you a simple test you can do at home to find out whether your body is ready for this practice or if you're at serious risk. If you're over 45, this might be the most important video you'll watch this year on this topic. Getting informed now can prevent problems that many people only discover when it's already too late. Everything we share here is based on science and medical evidence. If you haven't subscribed to the channel yet, take this chance to join our community. Regardless of my personal opinion, the truth is that people continue to practice anal sex. Both men and women seek professional guidance. Some even travel long distances and pay for private consultations just to talk about it. And now, you'll have access to this information firsthand. So, what should we understand? First, people's sex lives are changing all around the world. Even at 70, many people remain sexually active. A recent study from November 2024 showed that sexual activity in this age group increased by 38. Much of the confusion revolves around anal sex, as many women complain that their partners insist on it. And within the LGBTQ+ community, this practice is also very common. That's why so many questions arise. As a specialist, I'll share everything you need to know. This isn't about whether it's right or wrong, the practice will continue. But without the right knowledge, the consequences can be very serious. That's exactly what we're going to talk about from now on. First of all, we need to talk about anatomy. Understanding how the body works is essential for any safe sexual experience, especially anal sex. In the anal area, there are two important muscles called sphincters, the external and the internal. Everyone has them, but each serves a different purpose. The external sphincter is the muscle we use when we feel the urge to go to the bathroom but need to hold it. It helps control when we release stool, but it's not a very strong muscle. The internal sphincter is on another level. It's one of the strongest muscles in the human body. It always stays closed and only opens when it's time to have a bowel movement. So, the anus is not a door that opens easily. It has a natural protection system designed to keep the body safe. That's exactly why anal sex is completely different from vaginal sex. The vagina has a naturally semi-open entrance that allows easier penetration, while the anus is like a firm, closed, and sensitive wall. Trying to penetrate too fast or too forcefully can cause serious injuries. Painful fissures, muscle tears, and even fecal incontinence are real risks. Remember, the internal sphincter is what allows you to control your bowels. So any damage in this area can have serious consequences. The first practical tip is to start with an external massage before any penetration. This helps relax the muscles and prepares the body. In my clinic, I apply a water-based lubricant and gently massage the outer area for a few seconds. Then, I gently insert a finger slowly to help the muscle learn how to relax. This small preparation is essential and makes all the difference in both safety and comfort. Speaking of lubricants, never use oily, scented, or flavored products. They can cause small tears that take months to heal, and in some cases, may even require surgery. The ideal lubricant is water-based. It helps the body adjust without causing harm, and be careful, it's very important to lubricate both the anus and the tip of the penis, since the anal canal has no natural lubrication like the vagina. Ignoring this is one of the most common mistakes that lead to injuries. Now let's talk about position, a crucial point almost no one discusses. The most popular position, known as doggy style, is actually the most dangerous for beginners. Why? Because the rectum is not straight, it's curved. In this position, penetration creates an opposite angle to the body's natural shape, which greatly increases the risk of tears, fissures, and even fecal incontinence. The safest position to start with is lying on your side, as if you were going to sleep. In this angle, the penetrating partner's penis follows the natural curve of the rectum and points toward the receiver's navel. This reduces the risk of injury and makes the experience much safer and more comfortable. This kind of advice can only come from a specialist, because it requires detailed anatomical knowledge. Another key detail that most people don't know is that movements must be slow and gentle. Quick or rough movements can damage the sphincter, cause fissures, and worsen conditions like fecal incontinence, especially in postmenopausal women, whose muscles tend to become weaker. So patience and care are essential. Also remember, the anal canal and lower rectum have no natural lubrication. That's why using plenty of water-based lubricant isn't optional, it's mandatory. Without it, every movement greatly increases the risk of tearing and pain. Preparation should always include slow insertion with lubricated fingers to help the muscle relax gradually. This step is essential before full penetration. Now let's talk about something almost no one mentions: the rectum's curvature. Even some doctors overlook this. The rectum isn't a straight line. It has a natural curve that must be respected during anal sex. Ignoring this greatly increases the risk of internal tears or damage to the inner sphincter. Another important detail: the external massage should last at least 5 seconds, followed by the slow insertion of a lubricated finger. This process prepares the internal sphincter to receive penetration without pain or injury. It's a small step that can prevent serious health problems. And don't be mistaken, even experienced professionals can make simple errors that cause injuries. Poor lubrication, rough movements, or incorrect positions can lead to fissures, tears, or even incontinence. The problem is that many people only realize this after months or even years, when the symptoms become worse and harder to treat. Let's summarize the main points. Understand the anatomy, both the external and internal sphincter. Start with external massage and slow insertion using water-based lubricant. Lubricate both the anus and the tip of the penis. Avoid the doggy style position. If you're a beginner, prefer lying on your side. Keep movements slow and gentle. Stop immediately if you feel pain or discomfort. By following these steps, anal sex can be safe, pleasant, and mindful. It's about respecting your anatomy, preparing your body, using the right lubricant, and choosing the proper position. Small details can prevent major problems like fissures, sphincter injuries, or incontinence. With this information, you now have the knowledge to enjoy your sexuality safely, especially after 45. Remember, pleasure should never come at the cost of your health. The difference between a safe experience and a painful one lies in care, preparation, and respect for your own body. One of the most common questions I get from my patients is, "Doctor, do I always have to lie on my side for anal sex?" The answer is simple, but important. No, anal sex just requires extra caution at the beginning. Once you start from the side position, your rectum goes through an adaptation process. This means that over time, with safe practice, you can explore other positions without risking your health. But be careful. This freedom only comes if the first steps are done correctly. Respecting your anatomy and allowing your body time to adapt. Another crucial topic few people mention is condom use. It doesn't matter if you've been practicing anal sex for 20 or 30 years, a condom protects not only against sexually transmitted diseases, but also against bacterial infections that can become chronic. Think about it. During anal penetration, the urethra, the small channel where urine passes, comes in contact with the most bacteria-rich area of the body. The rectum has the highest bacterial concentration per cubic millimeter in the human body. These bacteria can easily enter the urethra and cause recurring urinary infections that are often hard to diagnose or treat. There's another serious concern: the transfer of bacteria from the rectum to the vagina. Many women come to me saying, "Doctor, I've seen several gynecologists, but I still have discharge that no one can cure." Some of these cases are directly related to anal sex followed by vaginal penetration without using a condom. This practice transfers bacteria from the rectum to the vagina, leading to persistent infections or chronic discharge. I'm not saying all vaginal infections come from anal sex. Changes in vaginal microbiota, vaginosis, or other imbalances can also be causes, but this factor should never be ignored. So please be cautious. Anal sex followed by vaginal penetration without a condom carries major risks. It can cause recurring vaginal discharge, urinary infections, and long-term complications if not treated early. Prevention is simple: always use a condom and maintain proper hygiene. There are no shortcuts. Another common question is about hemorrhoids. Many people ask, "Doctor, can anal sex cause hemorrhoids?" The truth is, if done correctly, no. The problem arises when there's not enough lubrication, movements are too fast, or the position is wrong. People with a history of hemorrhoids, especially those over 45 or 50, are more prone to blood vessel dilation, which can lead to bleeding, swelling, or even thrombosis. But the good news is, with proper care, good lubrication, and correct positioning, the risk can be minimized. Now, I want to share an extremely valuable tip, especially important for women who are in premenopause or postmenopause. It's a simple test you can do at home to check the tone of your sphincter. Here's how it works. Tighten your anus and see how many seconds you can hold the contraction. If you can maintain it for 8 to 10 seconds, your sphincter muscles are in great condition. If it's less than that, don't worry, there's a solution. Pelvic or perineal physiotherapy can help strengthen these muscles. And you can also do exercises at home. A simple routine I recommend to my patients is this: 3 sessions a day. 10 minutes each morning, afternoon, and night. During each session, contract as strongly as you can, hold, and then relax. Repeat several times. These exercises strengthen the sphincter and improve control, making anal sex safer and more comfortable. A strong sphincter doesn't just prevent tears and injuries, it also helps you maintain bowel control, avoiding embarrassing situations. This is especially important after age 45, when muscles naturally become weaker. Improving muscle tone means investing in safety, pleasure, and sexual freedom. Another key topic that few people discuss is the correct use of lubricant. Always use water-based lubricants, both in the anal area and on the penis. Insufficient lubrication or using the wrong products can cause fissures, tears, or even hemorrhoid thrombosis. Proper lubrication allows for gradual penetration, helping the rectum adapt without pain and avoiding sudden movements that could harm the internal sphincter. And don't forget, movements during anal sex should always be slow and gentle, especially at the beginning. Fast or rough movements can cause tears, fissures, and even worsen problems like fecal incontinence. Patience is essential. Listening to your body is more important than any technique or position. To summarize the key points: start with the side position at the beginning. It's the safest way to start. Later, you can explore other positions safely. Condoms are a must. They protect against urinary and vaginal infections, as well as STDs. Never switch from anal to vaginal sex without changing the condom. Always use proper water-based lubrication. Keep movements slow and gentle, respecting the rectal muscles. Test your sphincter tone with the contraction exercise, and strengthen it if needed. If you have a history of hemorrhoids, take extra care, especially after 45. By following these guidelines, you can enjoy anal sex safely, comfortably, and mindfully. With good information and care, you can reduce risks, prevent complications, and turn this experience into something positive for your intimate life without putting your health at risk. Remember, knowledge is power. Every detail from position and lubrication to condom use and muscle strength can make the difference between a safe, enjoyable experience and long-term health issues. Invest in preparation, respect your body, and always practice responsibly. Now that you know everything about anal sex, positions, lubrication, and sphincter strengthening, it's time to apply this knowledge carefully and responsibly. If you learned something new today, don't keep it to yourself. Share it with someone who might need it. One small detail can make a big difference in health and pleasure. And if you want to keep receiving practical, safe, and medical tips for a healthy, intimate life, click subscribe now. Turn on the bell and stay updated with everything that can transform your intimate life safely. Leave a comment: which tip did you find most important? Or if you've had a similar experience, share it. No one is judged here. We learn together. Remember, information is protection, knowledge is freedom, and care is pleasure. So, take care of your body and live your sexuality with confidence and safety.